All right, so today we welcome Mr. Wendell Potter, who is a former health insurance executive and journalist with over 4 decades of experience in communications. After witnessing how corporate PR and lobbying distorted policy and public understanding to protect profits over patients, he left the industry to advocate for healthcare reform. In 2009, Mr. Potter testified before Congress, exposing how insurance companies contribute to rising healthcare costs and coverage gaps. Since then, he has spoken at over 200 public events and authored several books, including New York Times bestseller Deadly Spin, Obamacare, What's in It for Me, and Nation on the Take, which was co-authored with Nick Penniman. Mr. Potter now leads two nonprofit advocacy groups, Business Leaders for Healthcare Transformation and Center for Health and Democracy, which coordinates with the Lower Out-of-Pocket Now Coalition and advocates for policies that lower and cap out-of-pocket healthcare costs. Mr. Potter, we are all yours.
Thanks so much. It's really great to see you all, and I'm encouraged that you all have an interest in talking to me. Appreciate that introduction. I have been active as an advocate for 16 years. Just last month was my 16th anniversary from becoming a whistleblower and testifying before the Senate Commerce Committee when Senator Jay Rockefeller was chairing that. We have a very different world now, sadly. The folks who I think would genuinely be interested in moving us forward are not running the show in Washington, so we're where we are. But that means that the work that we are doing not only continues to be necessary, but we need to redouble our efforts to do what we can to change who runs Washington, who runs the state capitals, and that's what I do these days. I publish a newsletter called Healthcare Uncovered, which is on the Substack platform, healthcareuncovered.substack.com. Please subscribe, it's free. You can pay if you got any extra money, but we want everyone to see our content, so there's no paywall. We've got about 16,000 subscribers, actually almost 17,000 now, and it's a good list. A lot of members of Congress and their staff subscribe to it, as well as reporters who cover healthcare and health policy. And we also have a lot of other advocates who follow the newsletter, and employers, brokers. It's a very good list. So please join us. We do our best to hold the health insurance industry accountable as best we can, because sadly, most of the rest of the media just doesn't cover it in an adequate way. I also lead the Center for Health and Democracy and the Center for Health and Democracy Education Fund. They're a 501c4 and a 501c3. I'm in Washington quite a bit, work with Rachel Madley, Dr. Rachel Madley, who is our Director of Policy and Advocacy, who worked previously for Congresswoman Pramila Jayapal. And Rachel is just terrific. And I have a small team of folks who help us get the newsletter out and do our advocacy work. We also focus somewhat at the state level. Our issues that we focus on, one way or another, revolve around the growth of big health insurance companies. Since I left the industry, the companies that I work for and others have gotten massively bigger. An argument could be made that the Affordable Care Act, which did a lot of good, also, though, I think enabled and maybe incentivized these companies to consolidate and get bigger and bigger. As you probably know, the biggest for-profit insurance companies control the Medicare Advantage program to a large extent, the private version of Medicare. It has grown rapidly as these companies have advertised a lot, obviously, to capture as many Medicare enrollees as they can. And we point out just how corrupt these companies are, how they are charging the government to the tune of about at least $84 billion this year alone. And that's from MedPAC, which advises Congress on matters pertaining to Medicare. Other estimates like PNHP have found that over $100 billion a year are being wasted in overpayments to these companies. So we spend a lot of our time focused on trying to get lawmakers to understand this, to do something about it. We focus a lot on other components of the health insurance industry, in particular the pharmacy benefit managers that the big companies own, including Cigna, where I used to work. It's one of the big three. Others are owned and operated by United Health Group, uh, which is the biggest health insurer by far, and CVS, which also owns Aetna. And collectively, those three companies control 80% of the pharmacy chain, and are responsible for which drugs we have access to and how much we'll have to pay for them and pay out of pocket. More and more people are having to pay considerable amounts of money out of pocket, even if they have insurance, before their coverage will kick in for drugs and other treatments. And we focus a lot on issues like prior authorization, which is one of the tools that insurance companies use to maximize their profits and create such a hardship for patients and a burden for healthcare providers. And as noted, we also focus on out-of-pocket costs, lead a coalition of about 110 organizations now called Lower Out-of-Pockets Now, which is focused on that issue to try to get the public and lawmakers and employers to understand that that's not sustainable. The Affordable Care Act allows health plans to saddle people with medical debt, families up to almost $20,000 out of pocket. So it's just an outrage what these companies have been able to get away with, what they continue to get away with. And sadly, we're not seeing, at least in this Congress right now, very much attention focused on addressing those problems and those burdens that so many people face. And I'm going to emphasize what physicians and other healthcare providers face. Prior authorization in particular is a huge time suck and a burden for staff at hospitals as well. There's no other country in the world that has a system like ours that places such a burden on healthcare providers. We It's been estimated that about a third, at least 30% of what we spend on healthcare in this country, and it will reach 8.6 trillion in 2033 by estimates by the government. And 30% of that goes to cover administrative costs, and that includes profits. And the big insurance companies are massively profitable. Last year, the seven biggest for-profit companies brought in over $70 billion in profits. And they have other ways of rewarding their shareholders. So it's a big scam in many ways. And the work that we do is to try to help people understand that and to get lawmakers to pay attention. I'm going to stop with that because I prefer to have a conversation and hear what you have on your minds and any questions you might have. So fire away if you'd like, or just tell me what else you think would be useful for our time together today.
I can start us off with questions. So we did, or we were provided a recording from a previous talk you gave to PNHP interns. And you talked a little bit about the Employee Retirement Income Security Act. I didn't get to do a lot of research about that before we talked today, but I was wondering if you could talk about that more and how it kind of blocks accountability for insurance companies.
Oh, well, thank you. That's a very important question because most of us who have health insurance, private insurance in this country, get it through an employer. And that law, which is known as ERISA, was passed in 1974 during the Nixon administration. And it was passed largely because employers, in many cases, or large groups, were absconding with people's pensions. So it addresses employee benefits. And over the years, those employee benefits have encompassed health benefits. It wasn't all that much of a big deal or even thought of about all that much back in 1974. But it gives employers and health insurance companies who operate as third-party administrators in this case, as it gives them enormous protection from litigation and regulation. The ERISA plans are theoretically regulated by the Department of Labor, but the Department of Labor has very few resources and very little interest, it seems, in really regulating this part of healthcare in any significant way. And as I noted, it's very hard for someone to even bring a lawsuit against an employer or a group that's protected by ERISA. And well over 150 million Americans are in employer-sponsored plans or group plans that come under the jurisdiction of ERISA. It's one of the things that I write and talk about quite a bit. Last year, I was given the opportunity to make a presentation at the Department of Labor to an advisory committee to the Department of Labor, but they would need to, frankly, have, they being the Department of Labor, changes in that law to really be able to regulate it in any meaningful way and also have more resources. It's also, by the way, a barrier to healthcare reform. And when we're talking about uh, trying to give states the ability to move to a single-payer healthcare system, for example, it always becomes an issue because a lot of employers resist it. They have a lot of money, and it's just something that has to be dealt with. And certainly, as we are looking to try to achieve a system in which Medicare is improved and expanded to cover everybody, that's an issue. It's something that is a real problem because a lot of employers are happy with that. Big employers in particular, small employers and mid-sized employers are finding that they're not able to stay in the game as much as they used to. A lot of small employers no longer offer benefits because health insurance companies have just priced them out of the business. The policies are just too expensive for them. But the big employers can afford it. They get a big tax break for offering benefits. So that's why we still have it. They have enormous power.
Zachary, you want to go ahead?
Um, and yeah, so again, we watched the previous recording from 2023 that you gave, and obviously it's a very different time in 2023, maybe a bit more optimism or whatever you'd want to say since the results of the 2024 election and what's happened since. But before you centralize an idea of incremental change in health reform and how you really think that that's the way that we can get to our final goal of Medicare for all. Has what's happened since changed your idea on that at all? Or do you still feel like we're on a good path and it's still feasible to achieve our goals with what historically we've been doing or promoting, which is incremental change?
We can characterize our path as necessarily good right now um, because of the current political environment. Uh, I will stress that right now it is just not politically feasible to move forward with Medicare for all. Legislation has been reintroduced in both the House and the Senate. Congresswoman Jayapal, who I've mentioned, is the lead sponsor of the legislation in the House, and Bernie Sanders in the Senate. They have hundreds of co-sponsors. But when you're not running the show, you don't even have a chance to call a hearing or schedule a hearing. And Medicare for All, sadly, has only had one or two hearings. I see Ed Weisbart on in the group, and he will attest to this. We have had one or two hearings in the past, but Democrats have to be in charge for even that to happen. Incremental change often gets a bad rap. But I think it's important to understand that what we're talking about here, I would often use the term foundational changes. We need to do what we can to make sure that the big guys, the big companies that I fight every day are not gaining more ground. And unless you're doing something to try to reduce their power and influence and get laws enacted to do that, then we get further in the hole. So I think it's necessary. PNHP certainly has been a leader in efforts to try to get Congress to address the problems with Medicare Advantage. I think that's essential. I think it's essential to try to reform the PBM business, to try to reduce out-of-pocket cost. If we just stay on the sidelines or just have a focus exclusively on pushing for single-payer healthcare or Medicare for all, a lot of damage can be done. And I would argue that not enough attention was paid to what was happening to the traditional Medicare program over the years, because insurance companies were quietly gobbling up big chunks of that program, or at least the people who are eligible for Medicare, to the point that now more than half of Medicare beneficiaries have been lured into these plans, sometimes against their will, because um, employers and large groups sometimes, including unions, are forcing people, if they want to continue to have retiree benefits, retiree health benefits, to be moved into a Medicare Advantage plans. We've got to keep fighting that. And maybe some people will call that incremental, but I think it's necessary.
Chris, go ahead.
Hi, Dr. Potter. I was wondering, since we haven't really seen the other side as much, what are the arguments that lobbyists for health insurance companies make?
And it's Mr. Potter. I wish I were a doctor, but I don't have that degree, and I've never practiced. I've worked with a lot of doctors, and grateful that I still am able to do that. And a lot of doctors, increasingly, by the way, are getting more motivated to get involved and to fight back against this crazy system. The insurance industry has been extraordinarily successful in their lobbying and PR efforts. Polls have shown over the years large percentages of Americans, many cases, a majority, if not significant majorities, favor having the government more involved in healthcare and moving to a Medicare for all type of system. But by the time the insurance industry gets done with its propaganda, a lot of people have lost their nerve and their support. Their campaigns are always based on fear mongering. They get people to fear that they're going to lose something that they think they currently have that's of value. And they always play the tax card, because if you're looking to move to a single payer system, it's publicly financed. And it's hard to get people to have that shift from viewing their premiums as a tax, and they should. But that's the hurdle that you've got to get across to persuade people that they're spending money and sending money, thousands of dollars, they and their employers, if they have an employer-sponsored plan, to big insurance companies. If we can get them to see that as a tax on them, that they have no control over, and it goes up every year. But that's basically their playbook. They instill fear in people. They know the language to use to get people to fear moving forward or to a system like that. And they also are successful in getting people to believe things that are not true about other healthcare systems. I used to be a part of that work. They also extol the virtues of the employer-based system. It's their bread and butter. That and the public programs, Medicare Advantage, and increasingly the Medicaid program. So they spend enormous amounts of money to protect that, and they're all big cash cows for them, and they spend lavishly on campaign contributions and lobbying. Over the past 5 years, the big insurance companies and their trade groups have spent almost $500 million lobbying in Washington, and that doesn't count the money that they spend lobbying at the state capitals.
If no other interns have questions right now, there are a few questions in the chat. And Mr. Michael Bacon said that he just read yesterday that prior authorizations may also become necessary with original Medicare, and that evidently CMS may contract with private companies to make determinations and incentivize them to reduce cost as much as possible, which incentivizes them to issue more denials. Do you think there that anything can be done about this?
I do, and it's an area that we're going to raise a big stink about. It's unbelievable on the one hand, but believable on the other, because the folks who are running the Center for Medicare and Medicaid Services, or that part of CMS, it's called CMMI. Uh, they undoubtedly are doing this at the behest of insurance companies. The Medicare program, the traditional Medicare program, makes very, very little use of prior authorization. About the only time that any kind of prior authorization is used in the traditional program is when something is considered cosmetic. Sometimes procedures can be both cosmetic but also medically necessary. So in those few instances, there is some review of a request for coverage. But by and large, prior authorization is not used, and it shouldn't be used. It's a big resource. When I mentioned about 30% of what we spend goes to administrative costs, a big part of it is because of prior authorization in the Medicare Advantage program and in private insurance and the Medicaid program. It's a huge amount of money, and it results in delays and denials. I think you all are aware of that, and is a means of these companies, or a way that they make such outsized profits. They avoid paying a lot of claims for necessary care that the patient's doctors know that they need. So we need to fight that, and we're going to be at the forefront of trying to do that and organizing organizations to draw attention to it and to fight. Whether we are successful, I don't know. It's within the executive department. They can do this without specific authorization from members of Congress, but we will be educating members of Congress and asking them. That includes Republicans too, by the way. A lot of Republicans are not happy with prior authorization. A few weeks ago, I had the opportunity to brief the GOP Doctors Caucus, and it comprises many, if not, I think all the doctors in the House of Representatives. Most of them are Republicans. There are some pharmacists who are part of that group, and they're almost universally opposed to and concerned about the growth of prior authorization. But I'm confident that that proposal is being done because there is potentially a crackdown on the use of prior authorization in the Medicare Advantage and commercial space. So they'd like to get their foot in the door in traditional Medicare, but also to try to make traditional Medicare less appealing. One of the talking points, one of the benefits of being in traditional Medicare is not being subjected to prior authorization.
Thank you, Mr. Potter. There was another question in the chat from Mr. Paul Warwick asking if you could comment on how budget legislation currently moving through Congress will affect private insurers.
They're not going to be affected all that much at all, sadly. There was a glimmer of hope at one point that the legislation might contain some constraints, some reforms to the Medicare Advantage program. On the Senate side, Senator Cassidy, who chairs the Senate Health Committee, the Health, Education, Labor, and Pension Committee, has co-sponsored a bill with Senator Merkley of Oregon that would address the upcoding in the Medicare Advantage program. That was not included. There was nothing included in the House bill either. So there are no significant reforms in that legislation to the healthcare companies. There also is bipartisan support to reform the PBM business, but nothing showed up in that bill. As all of us who follow that know, they're proposing massive cuts to the Medicaid program. That indirectly actually could be harmful to the profits of some of these companies because many of them get a very significant percentage of their revenues from the Medicaid program. Sadly, most states over the years have turned their Medicaid programs over to big insurance companies to manage people increasingly in Medicaid, on Medicaid, or in managed care plans operated by big insurance companies. So we'll see if this bill passes, many millions of Americans losing their health insurance, and that will have an impact on some of these insurance companies who manage those benefits.
What advice would you have to us interns, younger clinicians and medical students, to keep kind of pressure on the system and enact change in the future while still pursuing our careers?
Yeah, and I know that's hard because your time is especially limited early in your career, well, any part of your career, but certainly when you're young in your career. But if you can, please stay active. Join PNHP and stay involved. Become a leader in the organization. Try to persuade your colleagues, your peers, to do the same thing, to understand this, and to understand it is certainly ultimately about patients, but it's also about how you practice medicine. And increasingly, doctors are under the thumb of big insurance companies. They call the shots. They call the shots in Washington, as we're just talking about with public policy, but increasingly they're interfering with the practice of medicine. And also, it's very concerning that the biggest health insurance company, United, is also the biggest employer of doctors. So I would encourage you not to join a group that's owned by United or any kind of an insurance company. We're seeing, sadly, almost a disappearance of physicians in independent practice. Either insurance companies or hospitals have snapped up so many physician practices, private equity to a certain extent, but the majority of physician practices are now owned by either hospitals or big insurance companies. Try to stop that. Try to get involved. I mean, you're talking about your ability to practice medicine as you want, as you know you need to. It's also a reason why there's physician burnout, early retirements, and increasingly, and PNHP is involved in this work. There's a term that comes from war called moral injury, and increasingly doctors are using that term to describe what it's like to practice medicine these days in the U.S. They know that they really can't care for their patients the way that they've been trained to, and know that they need to because of constraints by insurance companies.
Jay?
Thank you, Mr. Potter. Just a follow-up question to that. What kind of positions or roles can physicians fill to try and accomplish some of what you were just speaking about? We have started to learn about in this internship of ours about advocacy and about some, writing that we can do to impact others. But is there anything else from your experience in the industry itself that you think might be useful for us to explore?
A lot of things, and you can do them individually or as a group. If you've got the time and the capacity and you can be anywhere close to Washington, show up down there, meet with your members of Congress. Often you'll just wind up meeting with staff, but that's fine because young staffers kind of run the show in Washington. They're exceedingly important. Uh, I often tell people it's not enough for you to know who your member of Congress is or your state rep or state senator. They need to know you. And I would encourage you to become visible, become a frequent flyer, if you will, to Washington, or to stay in touch, get to know staff, make sure that you are communicating on a regular basis, weigh in on these important issues. Don't think that it's a waste of time. I can assure you that if you're a big insurance company or that industry and you've got $500 billion to spend over 5 years, they blanket Washington with their propaganda. And we've got to do something to counter that. And yes, it's David versus Goliath, but it's really, really important. I can't tell you how important it is to have a connection with a member of Congress or a staffer. Let them know of your concerns and why you are concerned about a particular issue. it's obviously important to let them know if you support Medicare for all that you do. But as we were talking earlier, there are a lot of reforms that are before Congress at any given time that might get more currency if members of Congress and staff see that there are people who in their districts who are interested in that particular issue and are advocating for a particular form of kind of reform. Write letters, write op-eds, take a look at my newsletter. I'm open to, it's not just me holding forth. We publish other content as well too. And I would be open to hearing from you all as potential authors.
Therese?
Hi, I was wondering what your opinion is on gearing efforts toward a statewide single payer instead of a national healthcare program. Do you think that's more feasible under the current administration?
Well, it's more feasible than what we will get from the current administration. I think there's no doubt that's true. It's not an easy lift either way. And Congressman Ro Khanna of California is a lead sponsor of legislation that's about to be reintroduced that would make it easier for states to move forward with a single payer system. And there are a number of states that have lawmakers have wanted to do that. So I certainly support that. And there's an organization called One Payer States that's very active on that issue. We will be, my Center for Health and Democracy will be endorsing that bill and hope to interview Congressman Khanna about it. But again, it's not easy. I'm not trying to be discouraging, but none of this is easy. And there are the issues that you have to get around, like ERISA, and like how do you get waivers from the federal government to be able to move forward. Those things are necessary. That's not to say don't try, but just know going into this what you're facing and try to have your ducks in a row to counter that and facilitate your state if there's and there I've forgotten how many states there are that are part of one payer states, but it's significant, and I certainly encourage it. I'm agnostic as to how we get to Medicare for all or a single payer healthcare system. In Canada, it started at the provincial level, as you may know. It started in Saskatchewan, not even one of the bigger provinces, and it grew from there.
Natalia?
Hi, Mr. Potter. I'm kind of echoing something that I think Bob Krasson said in the chat about great upheaval provides great opportunity. Obviously, a lot is happening right now, and I'm wondering if the big beautiful bill passes, and obviously there will be more attacks on healthcare. How do you think this can open up opportunities to change the narrative around healthcare, both in politics in general, and then also especially in rural red states where they might be feeling the effects of this bill in particular? What do you think that might look like, and how can we leverage that to affect change?
Yeah, in fact, I think some of the most harm will be done in red states, states with large rural areas. These cuts to Medicaid, if they go forward, will just be devastating to hospitals in rural areas in particular, but also to safety net hospitals in cities. We've got to figure out how to message on this, how to make sure that it's a campaign issue in 2026, a midterm election. There are relatively thin margins in both the House and the Senate. We need to focus on making sure people are aware of the consequences of those cuts. Some of them won't be effective until after that election, so people will not be seeing the harm immediately, but we've got to communicate what's coming down the pike and how callous these members of Congress are and how this represents the largest transfer of wealth in probably American history. We already, I think, are exceeding the wealth inequality that we had even during the Gilded Age. And this is just a reprehensible piece of legislation, in my view, not really addressing the real fraud and abuse in our healthcare system that we've talked about, but going after poor people. We've got to get involved in that. To go back to another question, I would encourage you strongly to figure out how you can be active when the campaigns start for the midterms.
Zachary?
Just since you brought up the Gilded Age, I know one of the main developments or movements that was able to push us into the progressive era after that was the utilization of trust busting under Theodore Roosevelt. Do you think at this current state that it's even feasible to create change against the monopolies of the insurance industry? And should we start bringing back maybe anti-monopolistic sentiment and possibly break them up into a point where they have less consolidated power? Is that something you've explored?
Yes, yes, yes. And there is appetite for doing that. There is interest in that. And it's not just among Democrats. And during the Biden administration, the FTC was led by Lena Khan, who was really interested in this and was looking at these big companies, both from the perspective of how they have grown to control the pharmacy supply chain through their PBMs, but also toward the end of her term, looking at the Medicare program, the Medicare Advantage program. She had some conservatives who were fans of hers. They referred to them as conservatives, and they included Vice President Vance and Senator Josh Hawley of Missouri and others who have expressed concern about consolidation in this industry and others, certainly big tech, but also in healthcare. I think we absolutely need to press them on that. And one of the things that my team and I are going to be doing is helping people understand just how these companies are composed, what they really comprise these days. It's not very well understood. But that's a big part of our work, is to help people, including people on Capitol Hill, understand this. There's a Republican congressman from Georgia, Buddy Carter, who has repeatedly called for the breakup of United Health Group in particular. That company and others, they have a lot of enemies on Capitol Hill. They get a lot of campaign contributions, and that buys a lot of protection. But I think it's an angle we absolutely must pursue.
Ariana and then Caitlin.
Hi, Mr. Potter. Thank you so much for your talk. I was just wondering how you would suggest we battle the misinformation that's being put out there about healthcare from, political conservatives and insurance companies, and what kind of resources we should point to when we engage in this kind of political discourse.
It's a constant problem because you can get people to believe things that aren't true when you've got big budgets and can hire linguists and other language experts and communications gurus to help you scare people. But you got to do it. We got to be out there in that battle as well too, and helping people understand it. One of the things that I don't think that advocates have done sufficiently is figuring out how to talk to people in ways that really get through. I think progressives tend to just go out with facts and figures, and that's not going to do the trick. Even though a lot of the content we produce touches on that, you've got to connect with people emotionally, and you've got to figure out ways or how you can find common ground with people who might not agree with you ideologically, but to help them understand how they are being taken advantage of and how they are going to be so adversely affected by the potential harm that's being done by this legislation and by other changes. Uh, it's just another battlefront, but it's a very important one.
Keelan?
Hi, Mr. Potter. Is the background noise too much?
No, not now. It's
Oh,
fine.
okay. Okay, great. So I put my question in the chat, but I'd like to read it out loud if the noise is okay. I just wanted to say that from the video that we watched before, I was really fascinated and moved by your personal anecdotes about how you kind of came to terms with and realized that Cigna was responsible for many devastating outcomes, such as in your hometown, I believe, and also the rejected transplant story. So I'm just wondering, what is the best way to encourage more whistleblowers in insurance to change their minds and to speak up on a similar journey and path that you went down?
Thank you. And I know that there are plenty of people who work for these big companies who've seen what I saw, who have probably had moments of realizing that they're doing things that they view as unethical, or at least their company's business practices are unethical, potentially illegal. Uh, it's very hard to get someone to take that step, though, because when you become a whistleblower, you can be pretty certain that you're not going to work in a corporate job again. And a lot of people, certainly as they rise to the executive level, have to sign agreements that tie their hands. So it's a big lift, and that's why you haven't seen as many people step forward. To me, I had such what I've referred to as a crisis of conscience. I just felt I couldn't keep working in the industry, and in fact, I waited a year before speaking out because in my old job, I had even been a part of efforts to discredit the industry's critics. That comes with it as well, too. You're putting a lot on the line, and when you're putting your job and your reputation on the line, and knowing that you're going to be subjected potentially to criticism, uh, it's really, really hard. I do talk to executives and other employees of companies on a regular basis. They reach out to me, and there is an organization called the Signals Network, Signals, that exists to provide support, including legal support, to would-be whistleblowers. But it's a real challenge to get more people to step forward because of all the potential consequences, and I came to realize that I and I'm sure almost everybody else who considers doing this, you think of worst case scenarios, but I just came to believe that, well, the worst thing probably won't happen, and I'll probably at least be able to push a broom and do something. Uh, but I also saved a little bit of money, and that helps too. You have to anticipate, if you do this, that you're not going to be making as much money as you used to. So there are a lot of reasons why people don't step forward.
Going back to the chat, Mr. Hank Gorheis at Maine All Care asks if Dr. Oz promotes his Medicare Advantage for all from his new position at CMS, as he did several years ago as a Senate candidate, how would you frame an argument or campaign to simultaneously promote and contrast with improved Medicare for all?
To me, the most effective way is to try to persuade him personally, not attack him. I know that maybe that's something that some folks can do, and some folks have. But the reality is, it is true. He, in the past, has been a leading advocate of Medicare Advantage. He co-wrote an op-ed a few years ago. I think it was when he was running for the Senate here in Pennsylvania, with the former chair of AHIP, the big lobbying group for health insurance companies, advocating for Medicare Advantage for all. During his confirmation hearing, he probably surprised folks by saying that he understood some of the problems with Medicare Advantage, and that during his term as administrator of CMS, he would look into those and advocate for reforms or see what could be done administratively within CMS to address some of these reforms. So he's not been talking about Medicare Advantage for all since he's been confirmed and in that position. There are some of us who we're trying to see if we might even have a way of meeting with him. Some organizations, certainly, like I've said, have been very critical. They were certainly very suspicious of him during his confirmation, bringing that up, that he had been a big leading advocate of Medicare Advantage and had hundreds of thousands of dollars in stock in some of these companies, United Health in particular. But if there's an opportunity to educate him further and to keeping further harm from being done, I think it's worthwhile rather than just leveling a tax at him, because I don't think that's necessarily going to be doing any good. We just need to figure out the best way to communicate with him. And going back to what I said earlier, try to keep worse things from happening if at all possible. You may be aware that Project 2025, which came out of the Heritage Foundation and was talked about quite a bit during the last campaign, one of the provisions of that, or one of the suggestions or recommendations, was to make Medicare Advantage the default option for new Medicare beneficiaries. So far, that hasn't happened, and we just need to keep a close watch on that and see what we can do. Like I said, I was in Los Angeles in early June at a conference, a health journalism conference, in which the deputy administrator at CMS, Stephanie Carlton, was speaking. And she was very candid about the problems that she was aware of in Medicare Advantage. So that gave me some hope.
Also from the chat, Miss Mary Alice Bisbee from Rochester, Vermont asked, what about anyone needing nursing home care? Almost everyone needs Medicaid long-term. And Miss Bisbee, please feel free to unmute and provide context to your question if you'd like.
Well, I'll address that. There is no long-term public assistance really for Americans. When the Affordable Care Act was being debated, Senator Ted Kennedy at that point was trying to get long-term care included. It was not. It was deemed too expensive. So sadly, most Americans, as they get older, find that they just don't have the resources personally or from the government to cover what they might need if they need nursing home care or any kind of long-term care. It's a big problem, and also a lot of the big nursing home companies or facilities like hospice care are increasingly being owned by big insurance companies. United owns it has a lot of subsidiaries in that space. It's a big problem. The situation in this country often is that we have, as you probably know, what's referred to as dual eligible for many people who have Medicare. They also are enrolled in Medicaid. To be eligible for nursing home care, though, that's paid for, they have to spend down all their savings. So they have to become poor. It's just an unconscionable situation, but it is the reality.
Any thoughts?
Any thoughts on what can be done?
Yes, I was wondering about if they could get rid of Medicaid and put it all back into one big Medicare.
Well, I do think that there's no need, the Medicaid program was created at the same time the Medicare program was created. And Medicare, obviously, at that time, exclusively for seniors. It now provides care for a lot of people with certain disabilities. The Medicaid program was created for low-income Americans, so that we've had these two public programs. I don't think we need them. I don't think we should have. I think there should be one program. When we talk about Medicare for all, we're talking about Medicare for all. But like I said, Medicaid has become a cash cow also for big insurance companies, and states administer the Medicaid program, and most of them have turned their programs over to insurance companies to administer. So it's gotten entrenched into that mess. Yeah, yeah, it would be great, I think, to have one program and not distinguish one from the other, and not just have a program for low-income Americans, which, by the way, is the largest program. We have a lot of poor people in this country. A lot of people make less than the federal poverty line or close to it. But as you advocate for Medicare for all, point out that that would also bring Medicaid into a single program, and it could be done much more efficiently.
Ariana?
Yeah, thank you. So in both this talk and the talk that we watched prior to this, you spoke about, global healthcare systems like Cuba, like you mentioned people going to Cuba for life-saving treatment, and you briefly mentioned Canada during this talk. So I was just wondering if you think that there are any parts of global healthcare systems like those that the US can reasonably adopt as we work towards Medicare for all, or just like smaller steps towards reform to make like our system a little bit more equitable.
Yeah, absolutely. We need to spend more time, and our policymakers need to spend more time studying other healthcare systems. Uh, as I pointed out in a piece we published this week, we spend more than twice per capita on healthcare in this country than the average of other developed countries, and our results are so much worse. Outcomes are so much worse across the board. Our system is incredibly inefficient, riddled with administrative costs. But as I was noting earlier, the insurance industry has gotten people to believe things that just simply aren't true about the other systems. That aside, there's no one system. The system in the UK is different from the one in Canada, which is different from the ones in France, Germany, Japan, the Netherlands. The Commonwealth Fund, which is a New York philanthropy and research organization, every couple of years does a report based on an assessment of health system performance in developed countries. And the US is included in that and always is at the bottom of the list. And the top spot changes from time to time. The UK was at the top of the list a few years ago. France and Germany have been near the top. The Netherlands is also near the top. The Australian system is usually near the top. Look at that. It's called Mirror Mirror by the Commonwealth Fund, and it's pretty sobering when you look at it and learn how much less they spend and how they've all achieved universal coverage, and outcomes and life expectancy are so much better. But we've got a huge challenge of getting people to understand that and believe it, and to get policymakers to see them as potential models. I was in Colorado last month speaking to a group that advocates for Medicare for all. And one of my friends there, who's part of that organization, is T.R. Reid, who's a former Washington Post reporter, who wrote a book a few years ago. He was a foreign correspondent, lived in Japan, lived in Europe. So he became pretty familiar with healthcare systems. So he wrote a book that became a bestseller looking at other health systems. I recommend that, and Tom's going to start writing for me. So we're going to be trying to educate folks on what other healthcare systems do and what we can learn from them.
Is that great?
Going back to the discussion of like Medicare and Medicaid, it does seem in the United States there's some sort of consensus that the government has a role in helping people obtain health insurance, especially people who are disadvantaged or whatever term you want to use. And as a result, there's a lot of government funding that goes towards subsidizing those populations' ability to obtain health insurance. Have you ever experienced or heard of any success of a narrative of people framing that relationship between private health companies and the federal government as, or any sort of government, as us subsidizing their profits, just trying to change the narrative to we're already helping these companies make a lot of money by ensuring the less profitable communities, just in terms of building some more sentiment around the necessary changes that need to occur.
Yeah, one of the things that has become very evident is that people, it doesn't come as a surprise to me, but increasingly people are unhappy with private insurance companies. After Brian Thompson, the CEO of United Healthcare, was murdered last December, we saw people taking to social media to a large extent to express their frustration, their outrage at private insurance companies. It's there. People hold those companies in lower esteem than even Congress or cable companies. So we've got a lot to work with. It's hard to organize that outrage. And very few people are paying as much attention as we would like to what's going on in Congress today or this week. They're busy people, and they don't really, they're not as attentive to what's happening in healthcare as we are on this call, and people who are involved in kind of advocacy work. So there's a ton of education we've got to do to get people to not only understand the system better, but to do something about it. But at the end of the day, that's why I'm doing what I'm doing. It's education as well as advocacy, and doing what little part I can do to get people to understand it. It's very complicated, as you know. The healthcare system in the U.S. defies understanding almost. And the complexity benefits the big insurance companies and other big players in healthcare. I've often said it's so complex it makes your hair hurt. So you've got to get around that, and you get pretty quickly in the weeds and you lose people. So that's why you've got to spend time on messaging to figure out how you can talk to people without having their eyes glaze over.
Mr. Potter, I want to be cognizant of your time. This is slotted to end around noon, so let's plan to take these last 3 questions and then wrap up for the day, if that sounds okay.
That works. Thank you.
Yeah, Kenzie, go ahead.
Hey, Mr. Potter. In our discussions here, we've talked about some of the reasons that people oppose a single payer or a Medicare for all. And I think a few different times it's come up that people have a distrust for government, and that's one of their oppositions that sometimes it can be hard, at least for me, to overcome. What suggestions do you have for how to address that and how to address those concerns?
That is true, and it's so true. It's one of the reasons why one of the talking points by my former industry is that people don't want to have a government-run healthcare system. Avoid that term at all costs, because that's framing from the insurance industry and others who benefit from the status quo. It's misplaced anger and fear and distrust, in my view. There's not an understanding of how we have allowed big corporations to really control our political system. It's why I wrote a book called Nation on the Take: How Big Money Corrupts Our Democracy and What We Can Do About It. And I'm glad you brought that up, because I try not to miss an opportunity to say that if you advocate for healthcare reform, if you are a single payer advocate, spend a little bit of time, maybe as much time as you can, maybe even more time, advocating for political change, because the reason it is so hard to move forward, even with incremental or foundational changes, as I prefer to call them, is because big corporations and their trade groups can spend so much money influencing elections and public policy. The Citizens United decision from 2009 was just devastating, and it has given these companies far more ability to spend money to control public policy and campaigns than ever before. We've got to address the way that we do democracy in this country. I would argue that we long ago really lost democracy because we have allowed big corporations and also clearly billionaires to really determine who's in power and what policy is enacted. Well, we've got to do a better job. I'll make a final point on that, of helping people understand the problem is really corporate America. It is their ability to influence elections and public policy in ways that most people just simply do not understand. And they need to understand, or you all need to understand, that the reason there is this great mistrust of government is because my former companies and just about every big corporation has been engaged in efforts over decades to get people to distrust government, because they want lower taxes, they being the big corporations, they want lower taxes and fewer regulations. And to achieve that, they have to get people to believe that the bad guy is the government. That's been an ongoing problem, in particular since the Reagan administration.
Lauren?
Hi, Mr. Potter, thank you. So kind of going off of that and what you mentioned previously about you noticing public opinion kind of turning for the worse towards public or private insurers, despite the power they have in Congress. Do you anticipate the ways that they promote themselves to change in the future, or do you see anything happening right now with the way they promote themselves?
Yeah, they conduct what I've often referred to as charm offenses. They do that all the time when they feel that there is any threat to their profits. We see it going on right now. Just in the past few days, AHIP, which I referenced earlier, took the lead in having a press conference in Washington, getting Dr. Oz and Secretary Kennedy to join in and saying that the industry will take steps to reduce the burden of prior authorization. Do not believe these guys. It is just a charm offensive. What they're proposing would be voluntary in nature. There is no accountability. It's just, but it got quite a bit of press, and they were able to get Oz and Kennedy out there saying this is a good thing. That's how they roll. Do not believe these guys. Do not believe a word they say, in my view. Even their financial statements need to be looked at with skepticism, because they're not very transparent. They hide a lot. These are not trustworthy people.
Caitlin?
Thank you. I have a question. Can you speak on any retaliation from Cigna or other corporations in any attempts to silence or discredit you that you may have experienced after you spoke out? And then as just a related follow-up question, I was looking at Dr. Whitesworth's comment in the chat, and he says, I lost all of my supplementary consulting retirement income as soon as I published my first single payer op-ed, which made me think as future physicians who want to speak out on Medicare for all and criticize these powerful corporations, what challenges can we expect to face as we enter the field and continue speaking out? So
Yeah.
sorry, that was many questions. So.
I've been fortunate. Again, I assumed the worst case when I left Cigna and began to speak out as a critic against the industry, not just Cigna. I'll be quick to add, because all these companies behave pretty much the same way. So my remarks almost always are focused on the industry broadly, sometimes specifically to a company. I've been fortunate because one of my jobs at Cigna and Humana before that was working with media, so I understand the media. Had a lot of acquaintances with reporters, and I think they gave me a fair shake when I came out as a critic of the industry. I testified before Congress the first time, and that gave me some, if not protection, at least some sense that I was believable, had some credibility, and I was telling the truth. And I also have not disclosed anything proprietary about Cigna or Humana. There's no need to. There's enough about what they do that's not proprietary, that's sufficient to talk about and write about. So that gave me legal protection. I've not been sued, better knock on wood. But you do put yourself at some risk. If you decide to step out in any way, make sure you get a thick skin, because you likely will be criticized by some. Even if you write a letter to the editor, an op-ed, you may find some criticism, and there could be some consequences. But do what's right. Do where your conscience leads you. Don't be fearful of things that, someone say something mean about you. Just get a tough skin and do the right thing. I've had plenty of people who said mean things about me, but I don't care.
Thank you, Mr. Potter. I wanted to, since we have a handful of minutes left, I wanted to bring your attention to a comment made in the chat by Dr. Weisbart. He asked if you would support a cloning program so we could create a couple more.
That sounds like an Ed Weisbart. I wish. Yeah, let's do. Can we throw some money at that, or is all that money dried up from Doge? I don't know. Thank you, Wade. Good to see you. Thank you.
We have just 1 or 2 more minutes. I'm wondering, do you have any quick comments to share with our interns for tips regarding if they speak at any of these rallies that have been coming on, April 4, May 1, June 14, now coming up on July 17. And then also, whether you have any tips on testimony. You probably only have one or the other time to do that. So choose which one you want to hit.
I would say just in anything you do, whether you're at a rally, or try to use language that resonates with people who don't agree with you. It's okay to be a part of the choir and to preach to the choir. That's not enough. We need to expand the choir. So go into whatever you do with the thought of, how can I be persuasive? How can I communicate with someone in a way that they will see my point of view? That's my advice, whether you're doing it in any kind of forum.
Great. Thank you so much.
Thank you. Thank you all. Really appreciate this time, and really grateful that you have this interest in having this conversation. And I'm counting on y'all.
Thank you.
We'll make you proud.
Thank you. Thanks so much.